Hello, today we'll be talking about diabetic ketoacidosis. Basically, diabetic ketoacidosis is a condition where the patient's pancreas is not producing insulin, and the cells of the body are not getting the sugar. So the body stimulates secondary systems for producing sugars such as glyconeogenesis and glycogenolysis. And these systems produce ketone bodies. These ketone bodies eventually, through metabolism, are being turned into acids. And this leads to metabolic acidosis in the body, from where we can see a lot of symptoms. Also, since these people don't get the sugar into the cells because there's no insulin, they also will have a lot of sugar in their bloodstream, and this will lead to urination and hyperglycemia. So let's start with signs and symptoms. What we will see in a patient with diabetic ketoacidosis. So we'll start with nausea and vomiting. Nausea and vomiting. So where does that come from? So in the brain, there's a little nucleus in the hypothalamus, thalamus, that is called chemoreceptor trigger zone. So when there's a lot of ketone bodies, they affect that chemoreceptor trigger zone in the brain, and it stimulates the nausea and then vomiting. So we'll go further. Arrhythmias and chest pain. So patient will experience arrhythmias and chest pain. Where would that come from in diabetic ketoacidosis? Well, these patients will have too much potassium in their bloodstream due to acidosis, metabolic acidosis. There's ways to get hydrogens, the free hydrogens that are causing the body to be acidic. They're being pumped into the cells, but in exchange for potassium. So cells will release the potassium into the circulation, and increased potassium will lead to arrhythmias and the chest pain and palpitations. So there's another thing that potassium can affect, increased potassium can affect. It is the intestines. It will affect the intestines. It will cause them to slow down, which will lead to ileus. And since the intestines are not working, they slow down their activity, their peristalsis. The bacteria are still producing gases, and they byproducts of their metabolism. They produce gas, and this gas will bloat the intestines. The intestine will become bigger from the gas, and this will cause the stomach pain. Well, next we have let's go hyperventilation and fruity breath. So where does that come from, the hyperventilation, fruity breath, and Kussmaul breathing? Well, Kussmaul breathing is the kind of hyperventilation. So this comes from the acidosis, from metabolic acidosis. Since we have too much acids in our system, through special systems, the body will convert acid into carbon dioxide and water. So carbon dioxide, when there's too much of it, it stimulates the chemoreceptors in the carotid arteries. Chemoreceptors that stimulate the brain again, a little bit lower in the pons. In the pons to increase, let's go like this, increase the respiration, to blow off the carbon dioxide. So there comes increased respiration. So what about fruity breath? Well, fruity breath comes from ketone bodies. Ketone bodies. As I said, through metabolism, they're being converted into acids. Well, one of the byproducts of this conversion of ketone bodies is acetone. And acetone smells like fruits, so they will have fruity breath. Again, next we have polyuria. Well, polyuria. By the way, I wanted to draw a little cup right here, and it's full of water. So polyuria, since they're having too much glucose in their system, the body will try to get rid of the glucose because the body will be like hyperosmolar. They will start to diurese. They will start to pee off that sugar, but at the same time they will lose water. So we will see the increased urination. Eventually, by the way, urination will decrease. Output. The urination will decrease because gradually there will be a reduction in blood volume. So they keep peeing and they keep losing water, so that will lead to decreased blood volume, which eventually will lead to decreased urine output as kidneys get less and less of blood supplied to them. So to compensate for that, to compensate for decreased blood pressure, blood volume, polyurine, the sugar that is being peed out together with water, the person will start drinking more. They will be thirsty, their gums and oral mucosa will be dry, and they will also develop tenting from dehydration. So as we see the polydipsia, all this leads to weight loss and dehydration. Also, when the body is dehydrated, they will have the fluid from the brain. So the fluid from the brain will start to go into the circulation too. The water will follow the sugar, and in their muscles, the water from the muscles will also go together with the sugar and come out of the body. So when the patient is losing the fluid from their brain and from their muscle, so it will lead also to symptoms. So when they're losing from the brain, it will lead to altered mental status and confusion. So for example, if you have a patient and he is developing diabetic ketoacidosis, one of the signs, he will act differently. He will be probably try to vomit and feel nausea, but they also will stop answering you the questions about who they are, where they at, what's happening, why they're there. They will not be able to answer those questions. They will be very confused. Also, since they're losing the water from their muscles, they will experience weakness. So after a while, that glass of water, they might not be able to get to their mouth. So this is a short explanation of signs and symptoms and where they're coming from. And I will go farther. So, for example, I will move to etiology. So if the person is having they have that diabetes type 1, and they're fine, they're controlling it well, and all of a sudden something changes. They develop a urinary tract infection from a catheter or from other ways that they got the bacteria into them, or pneumonia. They went outside in the winter time and didn't take any precautions to keep themselves warm, and they were running around and breathing coldest air. Or they develop cellulitis from some kind of wound. So infection can lead to diabetic ketoacidosis, where all these things will cause to increased stress on the body, which will increase demand for insulin. And the body will not be able to meet this demand because the pancreas will not producing more insulin. So infarction, myocardial infarction, cerebral infarction also will lead to stress, intoxication, increased drinking alcohol, cocaine, methamphetamine. Also, not only methamphetamine, like hyperactivity, HDND, hyperactivity meds can cause that. Inappropriate withdrawal of insulin, well, that's just poor monitoring and not taking enough insulin. Inflammation, where their gallbladder is inflamed, which is called cholecystitis, or inflammation of the pancreas, pancreatitis. Also, iatrogenic, that's where the medical field professionals are giving them steroids which increase their sugar. So all these things can cause diabetic ketoacidosis in type 1 diabetics.